Okay, what if you had to make a life-altering medical decision right now? Today, we're going to do just that. We're stepping into the shoes of a doctor to solve two critical puzzles that can come up during pregnancy. We're going to use the exact same clinical clues they do to navigate these high-stakes scenarios. So, let's get into it.
And the stakes? Well, they really couldn't be higher. The choices we're about to explore can literally change the entire course of a pregnancy, affecting both a mother and her baby. Their health is in our hands, so let's get focused and figure this out together. So here's our game plan. First, we'll meet two different patients, each with their own unique puzzle. We'll break down their cases, and then we'll pull all our findings together into what I'm calling a proactive playbook. And finally, we'll see why all of this proves that every single doctor's visit is just so incredibly important. All right, time to meet our patients. We're about to look at two very different situations, and each one presents a really critical choice. You see, the challenge here is knowing when to step in and act decisively, and when the absolute wisest move is to just wait. So our first case is all about a patient whose medical history is sending this clear, unmistakable signal, kind of like an echo from her past that's affecting her current pregnancy. And the key to protecting her? Well, it's learning how to listen to that echo. Okay, so here's our first patient. She's 31, she's 12 weeks along, and her blood pressure today, it's perfectly normal. But look at that third line, a history of pre-eclampsia in her first pregnancy. That is the one signal we absolutely cannot ignore. So what even is pre-eclampsia? It's a really serious high blood pressure condition that happens during pregnancy. And here's the absolute core of this puzzle. If you've had it once, your risk of it happening again goes way, way up. That history changes everything. So the question is staring us right in the face. We know the risk is there, just lurking, even though she has zero symptoms right now. So what do? What's the right move to protect her and her baby? And the answer, believe it or not, is both incredibly simple and powerful: a daily low-dose aspirin. I know, that might sound surprising, so let's break down exactly why this is the right call to make. The aspirin here has absolutely nothing to do with pain relief. Instead, it improves something called placental perfusion. I want you to think of the placenta as the baby's fuel line. Aspirin helps keep that fuel line open and flowing smoothly, which directly cuts the risk of preeclampsia. But here's the catch. The key is starting it early, before 16 weeks, for it to be really effective. You know, this really brings us to a fundamental choice in medicine: proactive prevention versus reactive monitoring. Sure, we could just wait for the problem to show up, but that's like waiting to see smoke before you even think about looking for a fire. By starting aspirin now, based on her history, we're trying to prevent that fire from ever even starting. In this case, prevention isn't just the best medicine, it's the only logical choice. Okay, let's move on to our second case. And this one, it's totally different. If the first case was all about acting on a signal from the past, this one is about knowing when to take a calculated pause and just let the future unfold a bit. So let's meet our second patient. She's 24, she's at her 20-week anatomy scan, and everything with the baby looks fantastic. But there's an incidental finding. Her placenta is positioned really low in her uterus. Now, here's the most important detail of all. She feels completely fine. No symptoms whatsoever. This condition has a name. It's called placenta previa. And what it means, essentially, is that the placenta is blocking the exit. Now, this can be a very serious issue, especially when it comes time for delivery. So here we are at our second puzzle. We know the placenta is in a potentially tricky spot, but our patient is totally asymptomatic. So what do? Do we intervene aggressively, or is there a smarter way to handle this? In this situation, the absolute best course of action is that calculated pause we talked about. We advise something called pelvic rest, which basically means avoiding certain activities that could cause bleeding, and we schedule a follow-up scan for later. See, we're not ignoring the issue. We're just giving it time. So why is waiting the right move here? It's pretty cool, actually. The uterus is constantly growing and expanding throughout pregnancy, and as it gets bigger, it very often just pulls the placenta up and away from the cervix. The truth is, the vast majority of low-lying placentas found at 20 weeks will have moved to a perfectly safe position by the third trimester. Our job is just to wait, watch, and then reevaluate. And this timeline just lays out that journey perfectly. The The diagnosis at 20 weeks isn't the end of the story, not even close. It's really just the beginning of a monitoring phase. The real decision-making doesn't happen until after that 32-week scan, when we have the definitive information we need to plan for a safe delivery. All right, so we've solved our two puzzles, one with immediate action, the other with strategic patience. Now, let's zoom out and build our proactive playbook, using what we've learned from these two very different experiences. Here it is, 3 simple but incredibly powerful steps. First, always look at the history, just like we did in case number 1. Second, act on evidence. Using aspirin isn't a guess, it's a proven strategy. And third, and this is crucial, know when to monitor and reassess, which was the key to solving our second case. And this is really the central lesson, isn't it? We had 2 patients, 2 different conditions, and 2 completely different plans of action. One was immediate, the other was all about patience. And yet, we got to both correct answers by applying the exact same framework: history, evidence, and reassessment. So what's the big picture takeaway here? Why does mastering this kind of thinking matter so much? Well, it all boils down to one thing: the power of foresight. Think about it. Every single prenatal visit, every scan, every question asked and answered, it's all a data point. And these data points are what give us that foresight, the ability to plan ahead, whether that plan is to start a medication or simply to wait patiently. This is how medicine shifts from just reacting to problems to actively preventing them from ever happening. And that right there is the ultimate takeaway. In both of our puzzles, foresight was the most powerful tool we had. The ability to see what might happen and then act, or to purposefully wait, that's what transforms good medical care into great medical care. And that's what ensures the best possible outcome for every single patient.